Okay, now that we've learned how to enter in our supplies or medications, we are now going to show you how to dispense from Easy Med Records. And we're going to go ahead and start by clicking the button just to the right of RX Supplies down to the bottom. And you can see that takes us to the dispense detail screen. And to get started, there's a variety of ways that we can dispense or track a patient. And we'll start out by clicking the plus sign in the upper right hand corner. And let's begin by starting, maybe we want to go ahead and track a patient's use of an undergarment. In this case, Depends. We would click on tracking. We would begin by clicking on patient. And let's go ahead and choose Mary Johnson. And what is it that we're tracking or scheduling at this point? We may have one. Let's go ahead and schedule this for every day at 8 a.m. And we were talking about Depends undergarments. There we go. And this is going to go ahead. It defaults to starting Thursday, June 11th, 2015 at 3 p.m. And again, this will now start tomorrow at 8 a.m. So this has been scheduled just by merely tapping the button. If I wanted to go ahead and schedule this for 8 p.m. as well, I could do that by simply tapping the button. But that's it. And so this has been scheduled for 8 a.m. I'm going to go ahead and click Done on the upper right. And you can now see that this is an undergarment will be dispensed at 8 a.m. every day. Let's go ahead and try something else now. We're going to go ahead and dispense maybe a medication at this point. And we're going to start by clicking the plus sign. And let's go to a routine or a scheduled medication. And in this case, we want to make sure that we have the right patient. We are. We're going to talk about Mary Johnson today. The medication that we're talking about, so here you're going to see this is where we've previously added in either A, a controlled substance, B, a regular, like a Depends undergarments, and a C would be an inactive supply, and we'll talk about that later. But right now we're talking about a controlled or a regular, and in this case, let's go ahead and schedule a controlled substance of oxycodone 3 milligrams per dose. And you can see the dose appointment is 1. It's going to start Friday, June 12th, which is tomorrow. And you can see we can set some custom frequencies, but again, we're going to go ahead and set this for 12 noon every day. And if we wanted to schedule that for 8 p.m., we could do that as well, just by merely clicking on these buttons. But that is set for 12 p.m. For the patient Mary Johnson, oxycodone 3 milligrams per dose. Dose per dispense appointment is 1. And to set that, we're just going to click Done on the upper right-hand corner. Okay, now you can actually see the scheduled amount for the oxycodone for Mary Johnson. And the buttons at the top here allow you to place something on error, something on hold. Say the doctor wants a hold on this dosage amount. Let's just say the patient refused it. Self-administered, dispensed, patient has taken it, and then of course the pre-pour amount. Let's go ahead and now check Mary Johnson's. Let's go ahead and check her blood sugar levels. So it defaulted to Mary Johnson right away. I'm just going to go ahead and click that so you can see that we do have other patients to choose from, but since we're working with Mary Johnson, we'll stay with her. And this is going to start June 12th at 12 p.m. And let's go ahead and schedule Mary Johnson for a blood sugar check at, let's just say 8 a.m. and 8 p.m. Okay, and we're just going to click Done on the upper right-hand corner. And if we wanted to set some other frequencies, you can do that. But in this case, I have it set for 8 a.m. and 8 p.m. Let's click Done on the upper right-hand corner. And you can see how the blood sugar levels have now been put into this detail screen, and I can just click into the blood sugar level. Now what's fascinating about this is that if it's a healthy blood sugar level, let's say 200, I click into the time, it will turn green. If the blood sugar level is around a hovering of 500, let's just say, and we click into the time screen, you can see that it turns red. It's an unhealthy blood sugar level. But if we find something maybe around 400, let's see, it's still red. Let's go to 300. I think there's another color in here. There it is, yellow. You can see that it turns yellow and it gives you a warning sign. So those are the blood sugar levels, and then of course the time. Currently, right now here, we're going to set that at 2:32 p.m. And we just hit that bottom right hand, drop the keyboard into its place, and it will go ahead and set that blood sugar time. Well, that's how we go ahead and schedule some of the features within the dispense module in Easy Med Records. And one other feature that I'd like to show you is an as-needed medication, or a PRN. And in this case, this is an as-needed basis. So this could be, if we're staying on the patient Mary Johnson, this could be an extra Dispence undergarment, and that could happen at any point in the day. But that's an as-needed basis, and of course it takes a snapshot of the actual time, and that's at 3 p.m. today. We're going to be giving out another one, and that will come out of the total amount that she has of the undergarments. So I'm going to click Done, and you can see that it went from 20 to 19. We actually scheduled one, and it was as requested. So thanks again for sharing with us how to dispense medications and supplies with Easy Med Records.